Hello everybody, I'm Angela and I'm going to be doing the thorax, lung, and respiratory exam on my mother. So first we're going to start off with inspection. So I'm going to look at her thorax shape and look at the AP transverse ratio, which should be 2:1. And then I'm also going to inspect symmetry, chest expansion, musculoskeletal abnormalities, and rib prominence. I'm also going to be looking at the breathing, her rate rhythm, depth, and any use of accessory muscles, which of note, her breathing looks symmetrical, chest expansion is symmetrical as well, no musculoskeletal abnormalities, and no abnormal rib prominences. Breathing rate is normal, as well as depth and no use of accessory muscles. Next, I'm going to be looking at the overall skin color, if there's any lesions around her thorax area, and any superficial venous patterns, which I don't know anything abnormal. Then while I'm inspecting and talking to her, I'm going to take note of any sounds I hear audibly without my stethoscope. This includes any wheezing, stridor, and any abnormal cardiac sounds. Then I'm going to be palpating. I'm going to palpate her spine and her musculature for any tenderness. I'm going to gently palpate the spine for any bony prominences or deformities, which upon palpation I don't note any. And then I'm going to also palpate the anterior chest muscles for tenderness, crepitus, or vibration. So I'm just going to palpate the front side of her chest here, which I don't know any tenderness, no crepitus, or any abnormalities upon palpation. Next, I'm going to assess thoracic expansion. So I'm going to have you just turn the chair this way to the side. And so I'm going to put my hands in a butterfly or W shape along the posterior thoracic. And I'm going to have you take a deep breath in and out. And then one more time and out. So whenever she inhaled, when my hands moved out, it was symmetrical. So expansion is symmetrical upon inhale. If indicated, I would also assess for tactile fremitus, which I can do in this video. So I'm going to turn it back. So with tactile fremitus, I'm going to use the ulnar surface of my hand, and I'm going to just go down both sides, comparing vibrations while the patient says 99. So let me say 99.
99, 99, 99, 99,
And I'm also going to do posterior.
99, 99, 99, 99.
So overall, I could feel the vibration within all parts of her lungs and thorax equally. If there was decreased fremitus, that would indicate a fluid or mass, which means an increase in consolidation possibly. Next, I'm going to percuss. I'm going to percuss in a lazy S pattern. So what is expected is resonance, and then dullness indicates any possible fluid mass or pneumonia. So I'm going to do lateral lung fields in a lazy S motion and also include the right middle lobe. And then I'm going to have her turn to the back so you can see. So again, in the lazy S motion. And all of the lung sounds were resonant. And in the right middle lobe as well. So I'll have you just put your arms like this real quick. And then also percuss lateral. And in the right middle lobe, which is resonant as well. No signs of consolidation. Next, since she's turned around, I will be assessing for diaphragmatic excursion, which measures diaphragm movement between inhalation and exhalation using percussion. And so I'm going to have her inhale and hold that breath while I percuss her posterior thorax. And then whenever I hear dullness, I'll take note of that and draw a line. So I'll have you take a deep breath. Inhale, hold that breath. So here I feel dullness, and then you can breathe now. Thank you. And then idealistically, I would also have her take a deep breath in and then percuss the other side. But for exam purposes, I'll say that both sides I measure symmetrically, and so I would have drawn a line here to assess for later. And then I'll have you take a deep breath in, and then just exhale out for as long as you can and percuss. And then so I feel or I hear dullness upon percussion here, and the measurement from the inhalation that the percussion I did for inhalation and compared to exhalation, that would be her diaphragm, the measurement of the diaphragmatic excursion. Next and lastly, I'm going to be auscultating her lung sounds. So I will begin at the apexis, and then I would follow in a lazy S pattern, comparing both sides, also including both lateral fields and the right middle lobe. I'm going to be identifying for any vesicular, bronchial, and bronchovesicular sounds, and I'm also going to note for any adventitious sounds like crackles, wheezes, rhonchi, and stridor. So with my stethoscope here, I'm going to auscultate. So I'll just have, whenever you feel my stethoscope, I'm just going to have you take a deep breath in and out. And I'll just go here to this side. And the right middle lobe. Thank you. And then I'm going to have her turn to the front side. And then I'm also going to be listening to her lung sounds anteriorly. So same thing, whenever you feel my stethoscope, just take a deep breath in and out. Okay. And then that concludes the assessment, but special tests, if indicated, include tests of vocal resonance. So this is bronchophony, egophony, and whispered pectorally. So bronchophony, I'm going to assess just on the posterior because it's a lot easier to assess. But for bronchophony, I'll have her say 99 while I auscultate. So again, every time you hear or feel my stethoscope, just say the number 99.
99, 99, 99, 99.
So I won't necessarily hear her say 99. It should be more muffled. So if I were to hear 99 louder, that would equal consolidation. Next, for egophony, I'll have her just say the letter E every time you feel the stethoscope.
E, 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 E.
So if I hear A instead of E, that would indicate signs of consolidation. Lastly, whispered pectorally, I'm going to have her whisper 1, 2, 3. So every time you feel the stethoscope, just whisper 1, 2, 3. So I shouldn't really be hearing her whisper 1, 2, 3. If I did, in this case, it would be consolidation. But that concludes the thorax, lung, and respiratory exam. Thank you.